Hi, I'm Dr. Patrick Felice, double board certified plastic surgeon in Avon, Connecticut. This is a presentation on the abdominoplasty or tummy tuck procedure. Why consider a tummy tuck? Well, life happens. Pregnancy, massive weight loss, aging, bariatric surgery. We're seeing more excess skin with the new GLP-1 weight loss products, so that there are significant changes that occur. Physical effects are pretty much excess skin, stubborn fat deposits, weakened abdominal muscles, visible stretch marks, and something we'll discuss later, erectus diastasis. These can all create functional as well as aesthetic concerns. Understanding the anatomy, essentially, the anatomy is that the rectus abdominal muscles are paired going down the abdomen and they're adhered to by a fascial component here. As you have pregnancy, these separate to make room for the baby. The other reasons for separation are increased intra-abdominal fat, which can separate these as well. If there's significant separation, we typically perform erectus diastasis repair at the time of the abdominoplasty. Who's a good candidate? Well, the ideal candidates are healthy men and women who have maintained a stable weight for at least 6 months and have excess abdominal skin and fat that is resistant to diet and exercise. Post-pregnancy or weight loss is another good candidate. These folks have changes in their muscle tone, typically need erectus diastasis repair and removal of excess skin that did not retract after the pregnancy or weight loss. Important considerations are that these are not recommended procedures for those who are planning future pregnancies or have severe chronic conditions. Smoking cessation is critical. I typically want my patients to quit smoking at least 6 weeks before the surgery to minimize complications. You have to understand we are raising a skin flap essentially and making a large incision that will have its healing impeded in the presence of any nicotine. What are the types of abdominoplasty procedures? Well, the first listed here is a mini abdominoplasty, which has very limited applications. It's typically someone who just has a little bit of skin, possibly over a previous C-section scar, that can be removed in the lower abdomen. It's not meant to substitute for a full abdominoplasty. And typically, if a lot of skin needs to be removed, it doesn't look good to just do it in the middle portion and not on the sides. A full abdominoplasty pretty much extends from hip to hip in the bikini line, and there's an incision around the umbilicus. The skin from the umbilicus to the pubic area is completely removed. That skin is elevated to the subcostal margins. The muscle is repaired, and the skin is then redraped and brought down to the lower mons pubis incision region. With regards to suctioning circumferentially, I am not a proponent of suctioning anything in the upper region above the incision line at the same time as an abdominoplasty. Suctioning can safely be performed before time as a 360 if there's a lot of adipose tissue, but then at least 3 months to 6 months later, we would do the abdominoplasty. The reason for this is that you have a large incision from an abdominoplasty, and temporarily that lower blood supply has been compromised, and we're depending completely on that upper blood supply to heal that large incision. Anything that disturbs that upper region can lead to serious healing problems or even possible necrosis of skin in that area. Essentially, the surgical process is one of a very strategically placed incision so that we can hide it best in a bikini line. We elevate the tissue up to the subcostal margin and repair the abdominal wall. Once the abdominal wall's repaired, the skin is then redraped, and I like to contour the waist so that I can cinch in the waist a bit, so I shape it there, and then also place in my practice on-cue pain pumps because the rectus abdominis repair can be uncomfortable, more of a Charlie horse kind of sensation. And the on-cue pump allows me to drip a Novocaine on that area on the abdomen for at least 4 to 5 days. And it really seems to help a great deal with the pain. What are the risks and complications? Well, the most common concerns are bleeding or hematoma formation. Obviously, we want you taking it easy for a couple of weeks so that you don't have that problem. Infection at the incision sites, we monitor closely. Any poor wound healing or wound separation. Temporary or permanent numbness, that lower abdomen below the umbilicus can be numb for at least a year and sometimes permanently. Fat necrosis or fluid accumulation is called seroma, which may need to be drained, and deep venous thrombosis, clots in the legs if you're not moving around significantly. Now, as far as scarring, scars are inevitable, but strategically placed scars in that bikini line really blend well with any bathing suits or underwear. And on the right, they show the most serious complication, which would be a pulmonary embolism. And this is when a clot forms in the legs and is transmitted to the heart and lungs. This is a serious complication, and thankfully not one that I've seen in my 35 years of practice, but you need to be aware of it. We certainly take every precaution with medications and leg compression devices to prevent this. What you recover in aftercare? Well, days 1 through 7, rest is essential. You'll need assistance with daily activities, pain management, and drain care are your priorities. Light walking is encouraged to prevent any clotting within your calves. Weeks 2 to 4, you can gradually return to light activities. Most patients return to desk work. Drains are typically removed really in the first week. And you'll continue wearing compression garments as directed by us. Weeks 4 to 12, there's a progressive increase in activity. You could avoid heavy lifting for a bit longer, and as well as strenuous exercise. Swelling continues to subside. The incision lines begin to fade and flatten. Typically, I will let people go back to activity with regards to working out lightly and at the 6-week mark. 3 to 12 months, you'll see your final results emerging as swelling resolves and scars continue to mature. Your follow-up care, you will have regular visits with me immediately after surgery at 3 weeks, at 3 months, and 1 year. What can you expect after surgery? Well, there's a dramatic contour improvement. The waist comes in, you got the nice flat belly. You lose that bulge in the lower abdomen. You'll see a visible reduction of a lot of the stretch marks, and the skin tone is so much better. It's a life-changing impact. People that do this procedure have stated that they're sorry they didn't do it sooner, but it's a very well-accepted procedure. Is it right for you? Well, it's a powerful solution to a specific problem. There is a commitment on your part. I mean, it's not, like going to the beauty salon. This is a major surgery that, in the proper hands, is safe, but you have to conform to all the instructions and things that we give you, particularly for pre and post care. I'd like to invite you to a complimentary consultation. You can call 860-242-0505 and schedule that consultation with me. I'd be glad to discuss all these and see all these issues and see if abdominoplasty is the right procedure for you. I look forward to meeting you. Take care.